My name's Evie Lindemann. I'm an associate professor in the graduate program of art therapy. So I primarily teach graduate students, and I also teach one undergraduate course on death and dying. The art therapy program is an integrated curriculum between psychology and the arts. So when students come into the program, they need to be conversant and educated in both disciplines. The graduate program prepares them for professional lives as clinical art therapists. So it's quite rigorous. There's a lot of technique and art making, and there's also a tremendous amount of writing and theory that students need to integrate. So it's a terrific question to ask, how much art skill does a student have to have? We end up with students who are well versed in the psychological domain and maybe less so in the arts domain. And we have just the opposite of that too, students who are really truly artists and who have to pick up and engage in the more psychological aspects of learning to be an art therapist. But we train our students so that whether they come from a psychology background or primarily an art background, they integrate both by the time they graduate. So I don't think there's a typical student. They range in age from just fresh out of college to people in their 50s and sometimes their early 60s. They come from a variety of backgrounds. If they're older, we've had students who were trained as landscape architects, who have been mathematics professionals, students who have been artists. Some of them have not had professional careers yet, either because of their young age or other reasons. But they all have distinctive talents, and my role is to see them as art therapists in potentia. So when I view and meet and interact with my new students, I already look at them as though they have what it takes, and it's really just a question of awakening it. So once students graduate, they're eligible to take a test. It's the Licensed Professional Counseling exam. And after that is passed, they then need to accumulate 3,000 hours of professional experience. And they can then become licensed and practice independently or practice in clinical settings such as hospitals and private practices.